ask you to repeat yourselves. This is going to be interactive. It's only because I can't hear you, and if my voice comes in and out, then I apologize. But I'm not contagious, I promise. I'm Susan Ryder. I'm with Aurora Behavioral Health. We are an inpatient psychiatric hospital, and I'm one of the therapists there. So how many of you have heard what a psychiatric hospital is, or have any idea? Okay. Well, for those of you who don't know, it's like a medical hospital, but it's for mental health, and patients come in and they spend the night, or they come in and they come in for what's called day treatment, so they're with us all day long, and then they go back to their homes at night. So we treat ages all the way down to little 4-year-olds, all the way up through the end of the lifespan. I think our oldest patient so far has been 102 years old. So we deal with a variety of different things that have to deal with mental illness and mental health. And one of the things I first want to talk about is the fact that I absolutely hate the phrase mental health. Hate the phrase mental illness, because one of the things that we find is that there's a huge stigma about the word mental and using the word mental at all, because we associate it with crazy, right? If you're mentally ill, you're crazy, there's about you. And the problem with that is that it's very untrue. And all of us have mental health, all of us have mental illness issues, and it just kind of depends on, how strong or how weak those issues are. And I prefer to think of it in terms of brain health. I mean, if something's wrong with your kidneys, no one judges you for having kidney problems. If you have cancer, no one judges you for having cancer. If you have lung problems and you have to deal with lung health, no one judges you for having lung problems, or heart problems, or leukemia, or diabetes, or asthma. We don't make judgments about the person based on the sort of medical ailment that they have. But as soon as you say mental health, people start to make judgments. And they start making judgments about what kind of person you are and what kind of character you have and the sort of things that you must be thinking or feeling. And sometimes people get really frightened of you. And it's really unfortunate because what it does is it keeps people from getting the help that they need. And it keeps people from being able to access the services that they need, whether it be seeing a psychologist, whether it be seeing a marriage and family therapist or a social worker, or coming into the hospital. And it's really unfair because it keeps us from being able to get help, and it keeps us from being able to kind of interact the way we would normally interact with anybody else. So, for example, I'll use the example over and over again of the fact that I have asthma. And I'll be using that as kind of the medical side of the mental health piece. So we'll be talking about how I access treatment for my asthma and how my asthma affects my life in comparison to how someone who has depression or bipolar or an eating disorder or any other kind of mental illness, how it affects their lives. So today's going to be kind of interactive, and we're going to be doing a variety of things. So I want to make sure that we throw that out there. First of all, I know we're going to be talking about eating disorders, and it probably seems a little incongruent, but I do use chocolate as a bribe. And so what I'll be asking is, there'll be a series of times where I want you to participate. And so raise your hand, I'll call on you, I'll chuck, and I say chuck because I have to really pour a chocolate kiss at you. Whether you answer correctly or incorrectly, I'm not looking for correct responses. I'm looking for interaction. That's the most important thing today. And again, my aim gets better throughout the day, so first period was really bad. I hit a whole bunch of people in the head with the chocolate kisses. But we're third period now, so my aim should be a little bit better. Of course, having said that, I will have jinxed myself, and it'll be going awry all over the classroom. So if I hit you, I apologize. But there are going to be a whole bunch of opportunities for participation, and we're also going to be doing some group projects and some group work, and at the end we're going to do an art project. Because I think it's really important to kind of integrate all the different types of senses and all the different types of modalities in order to talk about mental health and talk about brain health and brain functioning. So, on that note, I want to start by asking you guys, when you hear the word mental illness, what sort of illnesses do you kind of conjure up and think about? Who can think of the name of mental illness? Yeah.
ADHD.
ADHD. So ADHD is attention deficit hyperactivity disorder. It also kind of goes hand in hand with ADD, which is attention deficit disorder. And it's a particular learning disability, a particular learning style in which someone can't pay attention the way that the average individual can pay attention. All right? Yeah.
Schizophrenia.
Schizophrenia. I'm glad you brought up my absolute favorite diagnosis at the very start, and as opposed to hitting in the back. So schizophrenia has to deal with delusions and hallucinations. So individuals who are schizophrenic either have hallucinations or delusions, and it affects their ability to live. So let me explain schizophrenia a little bit, because It's the one diagnosis that we most associate with being, quote, crazy. And it's the most unfortunate thing that we associate it that way. Schizophrenics who are hallucinating hear things or see things that the average individual doesn't see. So they hear voices, or they see people or things that we don't. Unfortunately, those voices are very disruptive. Imagine if you had your iPod playing at any given point, and it was speaking to you, telling you to do things all the time, over and over again. And you couldn't get the iPod to shut up. And all you wanted to do was shut it off and make it stop. And you have that voice, or those voices, over and over again. Imagine how distracting that would be, right? And sometimes I can imagine myself going, oh, be quiet, stop it, would you stop talking? Well, imagine encountering someone on the street who's doing that, and they don't have an iPod in. So a schizophrenic can seem a little odd or a little strange if they're responding to what we call internal stimuli. They're responding to those internal voices. Those internal voices can sometimes tell them to do things. Imagine, have you ever been in a situation where you're thinking to yourself and you kind of pose a question to yourself, kind of come up with an answer, right? I think we've all done that. You look in the mirror and you go, oh, that's okay today. Yeah, nah. Or, oh, should I wear that with that? You know, these are kind of, random, normal questions, right? And we answer ourselves in our mind. Well, someone who's hallucinating has that same kind of dialogue going on in their mind. The question is it really them telling them to do something, or is it an external, voice telling them to do something? And sometimes it can command them to engage in behaviors that are either odd or hostile. So sometimes it might be, you need to brush your teeth right now. Well, imagine if I whipped out a toothbrush in the middle of the presentation and started brushing my teeth. You're probably not going to be scared of me, but you're going to think, why is she brushing her teeth in the middle of the presentation? There's something weird about her, right? Well, that command hallucination might be something like, you need to go and run. So imagine if I just got up and ran out of the classroom for no reason. You might be thinking, what the heck happened to my speaker? I don't know why she's gone. So it can engage in some behaviors that are a little strange or awkward, but it can also sometimes be frightening behaviors. So sometimes it can be aggressive and sometimes it can be hostile. And that's why we often associate schizophrenia with crazy, because it seems crazy-making to us. The other piece that is part of schizophrenia is the delusional piece. And what delusions refer to is when you perceive the world differently than the way the average individual does. So for example, schizophrenics are often known to be very paranoid. And the paranoia comes from the delusion that they're being followed or stalked, or the CIA is after them, or the aliens are after them. Sometimes you'll see a schizophrenic walking across just randomly in the street and they're wearing a helmet. And you're wondering, why is this person wearing a helmet? Well, we wear helmets to protect our heads, right? So if I'm on a bicycle, I wear a helmet. If I'm on a motorcycle, I wear a helmet. If I'm doing something where I need protection, I'm snowboarding, I might wear a helmet. Well, a schizophrenic might wear a helmet because they want to protect themselves from whatever it is that they perceive might be harming them. But if you just saw a schizophrenic walking down the street and they're wearing a helmet, talking to themselves, you're thinking there's something quite not normal about this person. And so it can be really frightening for some individuals, and it can seem, quote, crazy. The thing that's important to keep in mind is that schizophrenia can be managed. And all the mental health diagnoses that we're going to be talking about, we're going to be talking about management. So like my asthma, we're not going to cure my asthma. My asthma is never going to go away. I'm always going to be stuck with being someone who has asthma. But I can manage my asthma. I can have an inhaler. I can either take an inhaler every day to make sure that I can breathe properly, or I can take an inhaler before I do something that I know is going to make my asthma worse. So if I'm allergic to a cat, I know that I'm going to be around a cat, I'll pop on my inhaler to make sure that I don't have an asthma attack. Or if I have activity-induced asthma, I might take my inhaler before